Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Kellen Mori. Born in Brazil, Dr. Mori is a member of the American Dental Association and has over 30 years of experience. She practices in the heart of Beverly Hills and focuses on compassionate dental care. Today we'll be discussing wisdom teeth. Dr. Mori, what exactly are wisdom teeth?
So wisdom teeth are the last set of adult molars to come in. They are called the third molars, and they usually come in around 17 to 25 years of age. And, they come in so late, so people call it wisdom tooth.
So when exactly do they come in, and why do they need to be removed?
So they usually come in at age 17 to 25. They don't have to be removed unless they don't have room to erupt or they're causing problems to the adjacent teeth.
And what age would be the preferable age to remove them?
So the age would be also 17 to 25. It's better when the patient is younger, so the bone is not as hard and the tooth is easier to be removed.
And you mentioned this earlier, but the reason you would want your wisdom teeth removed is because there's not enough, it's like overcrowding in your mouth?
Exactly. So wisdom teeth are the only teeth that don't have a primary tooth to guide the eruption. So they don't have any teeth that comes before them. So they are usually impacted. They don't have enough room, and the jaw doesn't have enough space for them to accommodate. So most of the times they come in impacted. So they're sideways, they're causing problems. So that's why you remove them.
And if you didn't remove them and you decided to keep them, are there any risks for that, or is it perfectly normal?
There are no risks. You can perfectly keep them.
Can you walk me through the process of actually getting your wisdom teeth removed?
Absolutely. So because they are so far back in your jaw, a normal x-ray cannot tell you where the nerves are going. So you have to take a panoramic x-ray so you can see exactly where they are, if they are tilted sideways, to avoid any problems when you're extracting. Because, if you're pulling a tooth and the nerve is so close, this mandibular nerve, you can get a paresthesia, which is something that your face will be numb. It's not permanent, but for about 3 to 6 months, you can get that side effect.
Wow.
The procedure is, you're going to get numb locally. Some patients are so fearful and they want to be put out. So we offer general anesthesia. We can have anesthesiologists that would come in and you'll be sleeping so you don't feel anything, you don't hear anything. But it's a really simple procedure. Any other extraction, you would get numb locally and it's just, removing the tooth.
Okay. And how many wisdom teeth do people generally have? Does it vary from person to person?
Normally 4.
Okay.
But some people only have 3. And that's a sign of evolution because in the past, in many, many years ago, we didn't have processed food and you had to really chew your food. Hence you have the third molars. But nowadays, with evolution where the food is all processed and soft, there's no need for the wisdom teeth and just,
So how would a patient prepare for this procedure exactly?
Well, the preparation, also you have to make sure if you are taking some blood thinners, aspirin, you should stop 2 days before. That's the main reason. So you don't want to risk the problem of bleeding too much. But there's not really much preparation that you need to do.
And how long does the procedure actually last?
Well, it depends how many teeth you are extracting. If they are taking 4, it may take from 1 to 2 hours. If you only take 1, 30 minutes. It depends on the surgeon as well.
Thank you so much, Dr. Mori. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on wisdom teeth. And so can you walk me through the recovery time and maybe things that you should eat, things you should avoid doing after you have this procedure?
So one thing I tell my patient is to avoid eating anything with small seeds.
Okay.
That can be pop seed, sesame seed, and really take care eating soft food. Ice cream is a great thing to do, you know.
Okay, doctor's
People
orders,
can-
ice cream.
can indulge on ice cream. And one thing to remember is that there's a blood clot that forms into that socket, and that helps the healing process. If you suck through a straw or if you smoke, you can dislodge the blood clot, and it can cause a dry socket, which is a very, very painful complication after wisdom tooth extraction. So you want to avoid that by keeping, the socket perfectly there. Don't do exercise or yoga upside down, carry too much weight. So it's very important to let your body heal. And I would say for a couple of days, just rest.
And is there anything specific people can do for pain management? Is it going to be swollen at night? Is it going to hurt maybe sleeping on a pillow?
It's better to take any over-the-counter medication. You don't need anything stronger than that. So if you're not allergic to Tylenol, Aleve, also do some cold and warm compresses, helps the pain.
How long does the swelling last? Because I know you can have swelling after any major dental
It can
procedure.
take from 4 to 7 days
Okay.
for the swelling to come down.
And how much does it cost to remove your wisdom teeth?
It really depends where you live, what part of the country, what state, but anywhere from $500 to $1,000 per tooth.
So is wisdom teeth covered under general dental insurance usually?
They are.
Okay.
They are covered under insurance, but for patients that don't have insurance, we offer CareCredit. It's a great way for them to get these treatments done because it can be costly, especially if you're removing 4 of them.
Yeah, I imagine.
So, they pay up front and you can take care of your problems, and we love CareCredit.
So Dr. Mori, I know you focus on compassionate dental care at your practice. Is there an aspect of your career that you really love or something you'd like to share with us?
Yes, I love being a dentist. I love being a dentist. It's the best, rewarding when you develop, and restore people's smile. I was very panicking as a child. I had fear of the dentist, and I decided to face my fear firsthand and help other people. So after my first year of dental school, I devoted my time, and for 1 year, I worked for free, seeing kids with autism and Down syndrome, because I wanted to give it back. So I think it's really important because when they trust you, they can let you do anything. So that was my give back, and I love doing that. Once a year, I go to a dental mission in the Bahamas where I treat many, many hundreds of patients for free, and I love what I do.
That's so wonderful that you just faced your fear head on, because I know as a kid being afraid of the dentist is part of growing up, but I'm sure in your care everyone feels so much more comfortable.
I was so traumatized. Like my family had to take me to the hospital, get general anesthesia to get all my baby teeth out. And I was like, there's better be another way.
I'm sure your patients feel so comfortable and at ease in your presence.
Yes,
Thank
they
you
do.
so much for sharing all of this wonderful knowledge with us today.
Thank you.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.